Hello and welcome back to Ask the Doctor. I'm your host, Mike Berger. We're joined today by Dr. Charles Powell of Healthcare Associates of Irving, and we're talking about Medicare, healthcare, and wellness for folks over 55 and older. We'd like you to join in. Just call the number that you see on the screen. It's 1-877-563-0099. Or you can email us at cpowell@healthcareassociates.com. The phone lines are open, and Donna is joining us from Fort Worth. Donna, what's your question?
I was calling. My sister has rheumatoid arthritis, and we're trying to find out, is there anything that can be done for it? Because she takes all kind of medicine, and no medicine helps. She hurts all day. She can't get up and down out of the bed. And I was just trying to see, is there any kind of medicine that she can take or anything?
Well, Don, that's a wonderful question, and I'm a little bit limited in my response, not knowing exactly what she's on to begin with, but I will tell you, yes, there are wonderful advances in the field of rheumatology, and this is where I usually enlist the help of a rheumatologist. But this is what's really essential, again, in a person's health care plan as they enter into the Medicare years. You've really got to have a primary care physician organizing and getting you into the right places to make sure that you're getting the care that you need. So in her situation, it sounds like it's been very debilitating for her. And let me tell you, it can be a tough disease state to beat. However, with a board-certified rheumatologist, a lot of advances have been made. I would really encourage her to see one either directly or through a referral from her primary care physician.
And I would think it would be so important to see a rheumatologist or somebody that has fibromyalgia. We talked about other diseases that are so debilitating, because when you can't move, when you can't exercise, things just kind of compound the problem, don't they?
It becomes a downward spiral at that point, and then before you know it, all kinds of other disease states are feeding into this, and it's often hard to reverse a lot of that.
Here's another email question. Comes to us from Brian in Flower Mound, and he would like to know, why is wellness what the government wants you to focus on the most?
Well, and again, probably in the first one or two segments of this program, we really talked about how the Medicare programs are changing. When you're looking at Medicare Advantage programs that are out there focusing on preventative health care, why is this so important? It's plain and simple. This reduces costs to the healthcare system over time. If we can help prevent the end disease states that cause so much cost within the medical community, if we take care of you and your health problems now, this is going to make you happier and healthier, live longer and happier, hopefully, and reduce the financial stress to the healthcare system.
And to yourself, ultimately.
Absolutely.
Another email question from Tom in Arlington. He would like to know, what are the major reasons for hospitalization of Medicare-aged patients?
You know, I think we've seen this change a bit over time. I was speaking earlier about the fact that it wouldn't be uncommon for me to admit 4 to 5 patients a night for just the 2 diagnoses of, evaluation for stroke or heart attack. And that number has really gone down. So have I seen a difference in the percentages of what are admitted for that? Not really, but the number of admissions are down. And I think largely it's because we're so focused on preventative services. For example, when I moved here 8 years ago after leaving the Navy and joined Healthcare Associates, one of the programs that was there that I just thought was incredible was an IV therapy clinic, which allows us to treat a lot of hospital-based diagnoses, such as pneumonia and various other things, on an outpatient basis, where the patients can come in for 30 minutes to an hour and get their antibiotics and not have to worry about the hard, uncomfortable beds and the bad food and everything else that can go on with a hospital stay.
Do you think we're going to see more of that as we move on here with the healthcare and the cost of healthcare? A lot more is going to be done in doctors' offices?
It's going to have to be. I mean, we have to find a safe and effective way to deliver this healthcare and how to choose the right people to deliver it to. You don't want to put people in increased risk, but we need to manage our Medicare dollars in a wise way that allows us to make sure that these programs are there for you now and in the future. And again, I'll come back around to these Medicare Advantage programs. That is one of the greatest utilities of them. They find a lot of the shortcomings that are built into the Medicare system, help you get around them, and ultimately stay healthier.
I'm all for help. We have another email question. It comes from Philip in Garland, and he would like to know, with all of the possible upcoming changes in Medicare, what can our elderly population expect? That is an important question.
And that's a tough one. You know, the current health care reform, I'll just be the first to say, something needs to change, okay? I love the fact that we're pushing more towards the direction of preventive medicine, but I can tell you right now, it's probably at least 5 to 10 times a week that I get a question from one of my Medicare patients or Medicare Advantage patients to say, what's going to happen in the future? With all the politics that are going on towards healthcare right now, is this going to be there for me? My answer to that is this. We don't fully know and understand what's going to happen in healthcare. Anybody that says they have a grasp on it, they may have a grasp on it today, but not tomorrow, because everything's going to change 2 or 3 more times. The fact is, we do know one simple thing. We've got to control the costs that we can and do what we can to keep everybody as healthy as we can to prevent those endpoints that put such a financial strain on the system. That's why at Healthcare Associates, we really are focused on preventative healthcare. It's not fair for someone to live their whole life and look at an endpoint of retirement and enjoying their life finally, with a set of rules stating that once you get there, your health care will be taken care of.
Well, and being fearful of the last years of your life. That
right.
Are you going to be okay? Are you going to be taken care of? That's really important.
But there's a new question on the table, and will it even be there for me?
Great question. Thanks to Dr. Powell of Healthcare Associates of Irving for joining us today. Remember, even though the show is over, your phone calls will be answered. Just call the number that you see on the screen, 1-877-563-0099, or email to cpowell@healthcareassociates.com. I'm Mike Berger. We'll see you next time.
This program is sponsored by Healthcare Associates of Irving and features medical questions from viewers. Nothing within the program establishes doctor-patient confidentiality.